guys, welcome to the lesson on CT and MR angiography. So CT and MR angiography are used to diagnose disease in vessels of the body, like in this MRI picture here. CT is computed tomography and MR is magnetic resonance. These two tests both use a type of contrast and are similar in results, but use different mechanisms to produce the pictures. Let's explore the difference. So the CT angiography uses radiation that bounces off of tissues to create cross-sectional images for a 3D view of inside of the body. So the type of contrast used varies. For the CT, it's going to be iodinated. Here's a picture of a CTA showing a huge abdominal aortic aneurysm. MR angiography uses a magnetic field to realign the hydrogen atoms and radio waves to cause them to make signals to create the pictures. MR is a high resolution imaging, and it uses gadolinium contrast. So guys, look at how cool this picture is and how clearly you can see the vessels in the brain. Next, let's discuss what to do to prepare the patient for these procedures. So before the procedure, check and make sure that the bun and creatinine are within normal ranges. Make sure that they've even been drawn. If they haven't been drawn, the radiology tech's going to ask you to have the doctor order them before using any contrast that could harm the kidneys. Ask the patient if they're allergic to contrast. If they are, ask them what type of test they had previously, because the contrast used for CT and MR are different. So if they're having an MR angiography, have them fill out that MRI form with you. Ask them those questions about metal exposure and then have them sign it. Fax it down to radiology so that they can look it over for any issues or contradictions before the test. There should be an area for contrast consent on that form as well. And if the patient's having a CT angiography, go ahead and have them sign that CT contrast consent after explaining the procedure. Disconnect any IV lines before the test because the tech's going to be using the IV for contrast administration. During the procedure, position the patient according to the body part being viewed. Ask the patient to stay still for clear images. We don't want to have blurry images. If the MRI is being performed, go ahead and remove any metal from the room, including wheelchairs, IV poles, extra beds, anything like that. After the procedure's over, check the IV patency. Just use a saline flush and then go ahead and reconnect any lines that are ordered, any IV fluids. Hold them at metformin for 48 hours to protect the kidney function if they're taking this drug for diabetes. Now let's talk about patient education. Explain to your patient the importance of staying still during the procedure. Have them follow breathing directions during the test. Radiologist is going to interpret the results and the doctor is going to explain the results after. Let them know when they can resume their metformin after so they don't have any confusion and they don't harm their kidney function. So the priority nursing concepts for a patient with a CT and MR angiography are patient education, patient-centered care, and safety. All right, now let's review the key points. So CT and MR angiography are both scans to view the vessels in the body for diagnosis. The CT angiography uses radiation to create cross-sectional images. The MR angiography uses a magnetic field and radio waves to create a high-resolution picture. Before the procedure, make sure any consent forms are filled out and disconnect IV lines because they're going to be used for contrast. During the procedure, ask the patient not to move and remove any metal from the room, including wheelchairs, beds, or IV poles. The radiologist is going to interpret the results, and the doctor is going to provide results to the patient. Okay, guys, that's it on CT and MR angiography. Now go out and be your best self today, and as always, happy nursing.